Okay, so welcome everybody, and thank you for watching this video. The purpose of this recording is so that we can sort of summarize some of the techniques we spoke about in a workshop that we held through the Wellness Center that focused on managing stress in graduate school. So I just wanted to briefly introduce myself before we dive in. I'm Ryan Savino. I'm a clinical fellow at the Wellness Center, and I'm also a doctoral student in the Grad Center. And I also have Lydia with me today.
Hi guys, I'm Lydia. I'm also a clinical fellow at the Wellness Center, and I'm a clinical psychology doctoral student at Hofstra University.
Um, we wanted to start with a little bit of a description of um, kind of the model, a very basic description of the model that we used, and that's um, uh, the strategies were based on a cognitive behavioral model, a type of cognitive behavioral therapy. Um, and so that kind of guided all the strategies we spoke about throughout the workshop.
So Ryan, could you tell me a little bit about if a student is struggling with stress about graduate school from a cognitive behavioral perspective, where do you feel like they could start to address their stress and worry? Because this is, a lot of what we talked about in the workshop.
Yeah, I mean, uh, one of the benefits of the cognitive behavioral model that informed the workshop is that there's multiple potential sort of like nodes or targets that a student might choose to address. And so we went through most or all of those through this CBT lens. So a student might learn strategies to try to respond more helpfully or adaptively to thoughts they're having that are related to worry or anxiety about graduate school. So there's a variety of techniques in CBT that target thought. We also spoke a little bit about how students might learn strategies to respond more helpfully and effectively to urges, action urges they might have. So those sort of that tendency that somebody might have to respond to their anxiety in maybe an unhelpful or rigid way. We focused on some of the skills that students might use in that area. Um, Additionally, we mentioned some techniques that graduate students might find helpful for responding to the somatic or bodily sensation, sort of embodied experiences that we might encounter when we're feeling anxious, such as racing heart, some techniques for kind of grounding related to those somatic experiences. And we also spoke a little bit about how students might work through in a very kind of problem solving, sort of step by step way to address events or external circumstances that are contributing to their anxiety about graduate school. So the model had a couple of different areas that students could target. Um, Another a central idea to the workshop was the importance of mindfulness. So we spoke about that relatively extensively in the workshop because it was integral to most or all of the skills um, in the workshop.
Yeah, so Ryan, how would you describe mindfulness and why do you think it's important?
Yeah. Um, so when I describe to describe mindfulness, it's probably also helpful to describe what it's not or to clear up common misconceptions about mindfulness. Mindfulness is not clearing your mind or emptying your mind. It's not even exactly getting into a state of relaxation. It might counterintuitively not be relaxing to be mindful. But what it is helpful to think of it as accurate awareness of the present moment. So that might be um, sort of internal experiences or sort of external events. A lot of the workshop we focus in on uh, mindful awareness of internal experiences, like the thoughts that someone is experiencing or their feelings or their sensations. Um, and why it's important is because uh, without the sort of firm footing of being aware of what's actually accurately happening in the present moment, um, it's very difficult to move forward and to develop effective solutions to the problems that are contributing to our anxiety in graduate school. So it's sort of about like collecting accurate data in a way about your experiences. Um, another another idea that is important throughout the workshop was the idea of developing a self-compassionate or a non-judgmental um, stance to our experiences with anxiety as graduate students.
Yeah, so can you tell me more about that? Like, what is self-compassion and why is it important, this work?
Yeah. So probably the most helpful way that I like to think about self-compassion is it's about cultivating a relationship with yourself. So it's sort of like a validating relationship with yourself. And so often graduate students or just people in general can learn to negate or invalidate or judge um, this sorts of experiences that they're having, and that just accentuates suffering. So acknowledging and validating that I am feeling this way and that there's multiple factors that are contributing to why I'm feeling this way can, in and of itself, be really self-regulating and powerful.
Yeah, that sounds really helpful. I'm wondering how can students spot when they're engaging in self-judgment? Because I could imagine when you're in it and you're feeling really stressed, it might be hard to identify those moments.
Yeah, so it can be. Um, uh, One of the most helpful first steps is again to try to cultivate or practice like awareness. So mindfulness. So a focused kind of noticing, um, being more intentional about noticing your thoughts or feelings. And CBT tends to emphasize thoughts and behaviors. So through a CBT lens, a student might start to practice becoming mindfully aware of their thoughts, and especially certain kinds of thoughts, sometimes referred to as unhelpful thinking styles, or other times referred to as cognitive distortions. So these tend to be kind of rigid or judgmental ways that a student might start to think about their own experiences. Um, so an example of that might be something like engaging in black or white or dichotomous thinking. But I'll hold some of that for a little later.
Okay, got it. So I think we can move into some of the strategies that we talked about during the workshop, because we want to make sure, these strategies are widely available to all students who need them. And we're going to start with
Yeah,
talking about emotional regulation.
can you tell me a little bit about what motion regulation really is? Can you explain it to me and the viewers, I guess?
Yeah, absolutely. So a really important point to keep in mind is emotion regulation is not about eliminating your emotions, which Ryan, you touched on earlier, because emotions are actually really important and useful in a lot of ways. They can tell us messages. They, can really convey, they're signs for us that we should heed. However, sometimes when we're having difficulty navigating really intense emotional experiences, like stress that comes up in grad school, it can feel really stressful and really overwhelming. So regulating emotions is essentially learning to manage and respond to your own overwhelming emotional experiences.
Um, yeah, it sounds like that's easier said than done. What are some specific skills or techniques that I might be able to use or that other grad students might be able to use to help regulate our emotions?
Yeah, absolutely. It's definitely easier said than done. But research shows us that there are a lot of specific skills that we can use. And I've used them as well, and they can be really helpful. So we'll go through some of those specific skills now, just so folks can practice them themselves. So the first skill I want to talk about today is using your body sensations to help regulate your emotions. And many of you have probably actually used these skills before. The idea is that by calming down your body, you're better able to slow down and manage an intense emotional experience. So one big thing you could try here is deep breathing. So breathing slowly in through your nose and out through your mouth can really help calm yourself down. Another thing you can do is called progressive muscle relaxation. An example of this would be like squeezing your fists as tight as you can for 10 seconds and then releasing them and trying to really completely relax your body, and like letting your hands just hang by your sides. And this pattern of tensing your muscles and then relaxing them can be really helpful as a way to regulate your body, regulate your emotions through targeting your body. You can also use a stress ball. You can squeeze it really tightly and then let go. You can also engage in intense exercise if you feel physically able, and that can help sort of tire out your body and calms you overall. Another body focused strategy is changing your temperature. You can splash cold water on your face. You can hold ice cubes in your hands. You can put a cold towel on the back of your neck or your face. These are all strategies to help you regulate your emotions by targeting body sensations.
Got it. So the skills sound like they could be really helpful to all of us. It's cool to see how I could potentially target um, sensations in my body to help um, kind of calm down or ground my emotions in the moment. Are there any other skills I can use for emotion regulation?
Yeah, definitely. So, that was targeting body sensations, but we can also target our thoughts to help sort of calm our emotions down. Um, this strategy is called check the facts, and it basically involves targeting the thoughts behind difficult emotions and testing whether that thought is actually accurate or not. So the first step there is identifying what emotion we're feeling, then noticing the thought that is prompting that emotion, and then testing whether that thought is objectively true or whether it might be biased. And that ties into what you were talking about earlier with those cognitive distortions. So for example, let's say you have an exam coming up and the emotions you're feeling are stressed, anxious, scared, maybe frustrated. And a thought that might be behind those emotions might be, I'm going to fail my exam. So now we've identified the emotion and the thought, and we want to test whether that thought is objectively true. Now, do I know that I'm going to fail the test? No, I haven't taken it yet. There's no way I could know that I'm going to fail, but I'm feeling really overwhelmed about it. However, I have been studying, I've spoken to my professor about material that was confusing, and they helped clear things up. So odds are I won't actually fail the test. It's just my emotions contributing to that thought. So, however, when I check the facts, I am reminding myself that I'm actually pretty prepared for the exam and I'm probably not going to fail. And sometimes we fall into thinking traps where we make assumptions or we blow situations out of proportion, and that can make us feel upset. So the idea of checking the facts is preventing ourselves from falling into these cognitive distortions. So in this example, we fell into the cognitive distortion of predicting the future. I don't know that I'll fail the test, but my emotions are telling me that I will. However, if I think critically about it, I realize that I probably won't fail. So it's important to identify if you're falling into those cognitive distortions, and then working to challenge those distorted thoughts. And, you know, we all have cognitive distortions. It's really easy to fall into those. So that's why, you know, this is a skill that you practice to get better at it.
Got it. So if I need to test whether my thoughts are valid or if I'm falling into a thinking trap, um, so if what what can I do uh, if my thoughts are really valid though, and if I'm really stressed? So yeah, what can I do when the thoughts are valid, when they sort of fit the fact?
Yeah, so that could definitely happen, right? Sometimes you test the validity of your thought, and in fact, you don't have any cognitive distortions, and you find that, you know, that thought is objectively true. When that happens, problem solving is a really great route to take. And that involves tackling a problem head on, but in a way that is less overwhelming. So it essentially involves breaking that problem up into really small, more manageable tasks so that the problem doesn't seem so daunting. So if we go back to our exam example, let's say I check the facts and actually it does feel probable that I'm going to fail. I failed the previous exam and I'm having a really hard time getting, you know, a good grasp on the material. So to problem solve here, I need to pick steps that are simple and achievable. So the first manageable task I'm going to do is emailing my professor and setting up a time to meet so that we can talk about the material and I can ask my professor the questions that I've been struggling with. So just sending that email is the first step. And, you know, it's the first step towards getting support. But once I send that email, the subsequent steps of having that meeting and figuring out a game plan for how to tackle the exam are going to feel much more doable now that I've gotten that process started.
Yeah, I see. I can imagine that just emailing the professor feels a lot more doable than the more daunting task of studying for a difficult exam. Are there any other emotion regulation skills that I could know about or that we should know about?
Yeah, so there's just one more that I want to cover today before we wrap up. The last emotion regulation skill I want to talk about today is called opposite action. And this is when we regulate emotions through changing behaviors. So we've talked about changing emotion regulation through body sensations, through targeting your thoughts, and now targeting your behaviors. So some background information is that every emotion has a corresponding action urge. For example, when we feel anxious about a paper, anxiety is the emotion, we tend to delay starting that paper. And in other words, we avoid it. So the action urge of anxiety is avoidance. And when we avoid, we tend to feel more and more stressed. Another example is sadness. The action urge of sadness is usually passivity, becoming withdrawn, and isolating yourself. And if we go along with these action urges, and if we're sad, we withdraw and isolate ourselves from other people, typically we get even more sad and upset. So the idea of opposite action is to actually do the exact opposite of the action urge. So if we feel anxiety, we actually approach whatever is making us anxious. If we feel sad, we reach out to, you know, a trusted friend or family member or peer who we feel like we can talk to. So we're doing the opposite of what the emotion is telling us to do, which, you know, takes away some of its power and helps us regulate and feel that emotion less intensely. So let's say you have a paper that you are anxious about, going back to that example. If you're feeling anxious, instead of delaying it, how about you take steps toward starting it? That's the opposite of avoidance, is doing the thing. And it could be, you know, just setting aside 30 minutes to start an outline of the paper. Again, small steps. And you'll likely find that doing that opposite action makes the process easier and reduces your anxiety. One thing I just want to point out is that opposite action doesn't mean just do the thing you've been avoiding or procrastinating. First, important steps are to acknowledge and validate the emotion you're experiencing, and then think of what the opposite is and try to move forward toward that. And you know, it's a skill. It's difficult. There's a reason it's called a skill. It's something that you need to practice to get better at. And like I said, it's really important to validate the difficult emotion you're experiencing before identifying that action urge and doing the opposite. But it can really be a helpful skill when we're feeling stuck.
Yeah, that does sound really helpful. I guess it often feels like that I just can't do the thing that I'm struggling to do. But I'm going to try to do the opposite action urge of my emotion next time. I'm going to try it out.
Yeah, 100%. And like I said, it takes practice. So it won't necessarily be easy the first few times that you practice. But yeah, so just to sort of recap what we talked about today, we talked about the CBT model of emotions, and we talked about some mindfulness and self-compassion. And then when we went through some emotion regulation skills of targeting body sensations, looking at your thoughts, and seeing if you're falling into thinking traps. We talked about problem solving, and lastly, opposite action. So we hope that these strategies provide some tips for managing stress in graduate school, and we really appreciate you taking the time to learn with us today. Ryan, did you have anything else before we closed off?
No, just I wanted to remind people of the resources at the Wellness Center. So students are eligible for individual counseling. We also have groups, workshops like this one, and couple counseling. I think that's in addition, we make referrals to outside providers. So if somebody's interested in finding a therapist in the community or a psychiatrist in the community, we can help with that.
Great, thank you
Yeah,
all.
thank you.